strict new lockdown has begun in the most populous US state, California, as COVID-19 cases continue to surge across the country. More than half of California's 40 million residents are subject to a stay-at-home order. People are banned from meeting anyone from outside their household. The order was triggered by growing pressure on intensive care capacity in hospitals. Let's go straight to our correspondent in Washington, Gary O'Donoghue. And Gary, as I was just saying, this is likely to last for about 3 weeks and affect about 40 million people.
Yeah, it's tens of millions of people in California, and it's been triggered by the fact that the numbers of hospital beds and ICU beds has fallen below a particular level, which has brought these new restrictions into place in an attempt to try and prevent those hospitalizations overwhelming the state's healthcare system. So in places like Los Angeles and further south in San Diego, these curfews and these restrictions on businesses because of the infection rates, joining a whole bunch of restrictions that are already in place up north in San Francisco and the Bay Area. So California is really one of the key hot points at the moment for the virus, Yelda, but it's not just there, it's across America. 6 days, the first 6 days of December, 1.2 million new cases in the United States.
Extraordinary and quite grim there, Gary. And just picking up on that point that you've just made, it's not just California. We're seeing a surge across the country. And there is a question then about the lack of leadership, certainly on a federal level. What is President Trump doing at the moment and saying, and what are we seeing from President-elect Biden?
Well, President Trump isn't doing anything visibly or publicly on the coronavirus at the moment. He attended a rally on Saturday night in Georgia where he said again that the country was turning the corner. And this, of course, is off a bunch of figures where we're seeing hospitalizations doubling in the space of a month. What we will see later this week, though, is the hearings around the Pfizer vaccine that have already been authorized in the United Kingdom. We're expecting that to be authorized probably on Thursday or Friday of this week here, and that distribution to begin a few days after that. So the administration say they've got the infrastructure and the plan in place to move that vaccine around the country. Of course, it has to be moved at very low temperatures, so the infrastructure has to be right for that. But it says that that is in place for that to happen in order, they say, to get maybe around 20 to 25 million people vaccinated by early January. And that would be people in long-term care facilities and some healthcare workers.
And Gary, give us an update on the situation with Rudy Giuliani, Donald Trump's personal lawyer, who has tested positive for coronavirus.
Yeah, we don't know how he is. We know that he's in a hospital here in northwest Washington, in Georgetown, that he was admitted yesterday. That came through a tweet from the president himself. We don't know how severe he's suffering from it, but of course he's been crisscrossing the country. I mean, from memory, he was in Atlanta at one point last week, Michigan, I think probably Arizona as well. He's been pictured at events without wearing a mask, with people without wearing masks. And, you know, and a lot of people in that circle and in the president's circle have had the virus. More, you know, you have to think about people in that circle who haven't had it rather than those who have had it. So he's now got it, his son had it. And we'll wait for an update on how he is, of course. But it does mean, of course, that the president's personal lawyer is out of action for the time being.
Gary, thanks so much, as always, for that update there.